Thank you very much for the opportunity to present on how to address NAFLD in other settings, globally and around the world. My name is Jeff Lazarus, and I'll be speaking on behalf of the EISL International Liver Foundation to present our latest work, including a new report published together with the Economist Intelligence Unit. So the EISL International Liver Foundation has 7 board members and seeks to increase the quality of life and reduce premature mortality for the greatest number of people by improving liver health. Our core mandate is to work globally, establishing and nurturing collaborations with all regions around the globe. We do this by engaging with a wide range of individuals and organizations, from professional associations, clinicians, and industry to leading think tanks. And over the past 2 years, we've expanded our work on NAFLD and NASH, building a global network of experts and organizations. So last year, or in 2019, we published a European NAFLD policy review study that really found that all European countries, or rather no European countries, were well prepared to address NAFLD and NASH. In 2020, we expanded that to over 100 countries around the world. We also held virtual dialogues on NAFLD models of care, and together with the leading think tank Wilton Park in the UK, we held an event called NAFLD, the Silent Epidemic. That report's available. And together with the Economist Intelligence Unit in 2020, we held 20 workshops focusing on Asia, Latin America, and the Middle East. Pardon me, it was 12 workshops. In 2021, now we're working on a NAFLD public health global consensus statement that many of you are a part of, and that will feed in, as I'll explain, to a NAFLD roadmap to address NAFLD from a public health systems perspective. So the series we developed with the Economist Intelligence Unit was titled NAFLD, Sounding the Alarm on a Global Public Health Challenge. Despite the imperative for action, NAFLD, as we all know, has received little attention in national and global health agendas. The foundation engaged the Economist Intelligence Unit to hold those 12 workshops, sounding the alarm on a global public health challenge. And this series explored the opportunities and challenges for addressing NAFLD with a specific focus on the Asia Pacific, Latin America, and Middle East regions. The 12 workshops involved more than 50 experts, from liver disease and diabetes specialists to primary care providers, as well as public health leaders. The workshops explored a diverse range of topics, from the diagnosis and care of affected populations to public health responses and the integration of NAFLD within the non-communicable disease agenda. Global and regional calls to action were developed based on the responses of the expert panel members. I'm going to share those with you in a moment. So some of the take-home messages from this series, well, it aimed to provide some strategic guidance around how to shape and deliver a more comprehensive response to NAFLD. The calls to action are the culmination of this process and cover a range of areas, from diagnosis and treatment to broader public health and non-communicable disease policies. These are ambitious, yet achievable, and can hopefully inspire action. Delivering on these will require concerted efforts from a range of stakeholders, including all of you, as well as healthcare providers, other healthcare providers, patient advocates, and policymakers. We need organizational and individual leaders to drive this process. So the global call to action was focused around awareness, risk stratification, integrated care, patient involvement, and non-communicable disease integration. All of this is available in the report from the Economist Intelligence Unit that was just published, and you can see the URL on the bottom left of my screen. The regional calls to action supplement this global call to action and focuses on the 3 regions I mentioned. They highlight the region-specific challenges and opportunities and can help to inform the priority actions. So briefly, the call to action from the Middle East region, in addition to what was set out in the global call to action, focused on integrating screening into health checkups for people with obesity and diabetes, as this could help improve the detection of NAFLD. It calls for multidisciplinary collaboration because this has been effective in raising awareness of NAFLD and should continue to be expanded. And interestingly, they put a focus on social media as a medium for mobilizing and amplifying the patient voice in place of patient groups where those are absent. For the Latin America region, also focusing on the high prevalence of obesity and diabetes there, the importance of integrating NAFLD screening into health checkups was stressed. Next, health system fragmentation was highlighted as a barrier to integrated and multidisciplinary care, and examples of local innovations that overcome fragmentation can guide implementation elsewhere. And in Latin America, there was a focus on task shifting, which can help to distribute the NAFLD workload across healthcare professionals, but this will only work if the general public has confidence in the skills of healthcare providers, such as nurses. And finally, for the Asia-Pacific region, endocrinologists and cardiologists require targeted awareness raising to ensure they understand the impact of NAFLD and their role in managing the condition. Now, this is likely the case in other settings, but this was highlighted in Asia-Pacific and forms a part of their call to action. Integrating NAFLD within the clinical guidelines for conditions such as diabetes and obesity, similar to the other regions, can help to raise awareness while also improving care, such as ensuring appropriate referral to liver specialists. And finally, care pathways with clear referral guidelines are needed in primary care to ensure that patients needing specialist management are linked to care at a timely manner, while also preventing specialist clinics from being overwhelmed by unnecessary referrals. As mentioned, the full report was just published. We're incredibly grateful to the Economist Intelligence Unit for this collaboration that spanned over a year. And as we all know, during a very difficult period where instead of meeting in person in the regions and at the international conferences, everything was carried out online. So what's next for the NAFLD public health agenda? Well, the collaboration with the Economist Intelligence Unit forms part of a larger EISL International Liver Foundation program on NAFLD. In 2021, we're currently conducting, as I mentioned, the first NAFLD public health consensus statement with over 200 experts from around the world involved, and we expect this to be published in late 2021. The consensus statement and other foundation activities will form the basis for a NAFLD public health roadmap, which we're co-developing with a global coalition of experts and organizations. And if any of you who aren't involved would like to be involved, do please contact the foundation or contact me directly, and we will welcome you on this path. So let me acknowledge and thank everyone who was involved in the Economist Intelligence Unit EILF workshops from the Asia Pacific, from Latin America, from the Middle East, as well as international guest participants who joined some of those sessions to provide expertise, as well as everyone at the EISL International Liver Foundation, our chair, Massimo Colombo, our secretariat, and particularly Henry Mark, who has been essential to making these workshops happen and providing us with the results. I'd also like to acknowledge the support from Intercept Pharmaceuticals, as well as GenFit, BMS, MSD, for supporting our work in the field of NAFLD and NASH. Thank you very much, and I look forward to discussing the public health aspects of NAFLD and NASH with all of you.